Hi, I'm Emily from Public Health Warwickshire. One of my lead areas is promoting mental health and well-being for our residents. And as such, I wanted to share with you some of my own experiences around the mental health and well-being challenges that we've all faced living through the last year, through the global pandemic. So there's a short video clip after this, which I hope you enjoy and encourages you to speak out about mental health. As I say, really encourage people to reconnect with people in person. I'm an absolute advocate of the 5 ways to wellbeing, and I've been promoting them for over 10 years now. They're very much evidence-based ways to support our mental wellbeing and our resilience. But of course, how we practice them has had to change over the last year. So, for example, one of them is to connect. So connecting with others, obviously a lot of it for us has been over a screen. And I know seeing my friend on the weekend, there's nothing like seeing somebody in person. It was very difficult to resist giving them a big hug, but it was really lovely to actually speak to them face to face. But we both shared that we were feeling quite anxious about it. Our social skills are a bit rusty and obviously haven't had that kind of contact for a while. And I'm sharing that really just to say, it's normal to feel a little bit perhaps unsettled as we start going out and about and meeting in larger groups. Again, it's normal to have been struggling with mental health challenges over the last year. I certainly have over the last 6 months plus, really. I think it takes a while for you to recognise when you're struggling, and often other people might notice some behaviour changes before you do. So IACT, which is improving access for psychological therapies. It's a service offered across the NHS, and you can self-refer. You don't have to speak to a GP to access that. And so I accessed it in autumn, had a short course of cognitive behaviour therapy with them, which was really helpful, and it was useful. It did help to an extent. So I started with an app, which was really good, but I didn't get all the way through the course. It wasn't quite for me because one of my challenges has been too much screen time, being kind of tied to the desk while working from home over the last year or so, and then phones and all the distractions that they bring us in our lives anyway. So I then moved over to a workbook, which they provided me with, and I found something very therapeutic actually about getting a pencil and a piece of paper out. So felt a lot better. I remember talking to my therapist on my final day of my Christmas holidays. It was my first proper break over the last year, and saying I felt much better. I was feeling like I was managing my worries better, sleeping better, putting more time and attention into my family and my relationships, which was helping to support my well-being. And then, of course, we went back to work during the January peak in cases, that New Year increase that we had in Warwickshire and across the country, and dealing with COVID every day and managing outbreaks and all the anxiety that brings with it. So I did go back to my GP, and I got some anti-anxiety, antidepressant medication, which has definitely helped to take the edge off, and really made me realise that whilst the 5 ways to wellbeing are fantastic and absolutely still trying to practice those, there is a time and a place for medication to help us when we need it. So sharing that to encourage people really to reach out for support if you're struggling at all. Just sharing with a friend can really help. But if you need to, there's lots of services and support available to help you further. So I think, it has been a year when it's been quite difficult to find joy at times. And so finding those little things. So in terms of the 5 ways to wellbeing, we've got connect. I've already mentioned connecting with others, keeping learning or rediscovering an old hobby. Perhaps I like a little bit of beadwork, managed to do a bit of that over the summer, though I have to admit my creative activities have only extended to adult colouring in books recently, which I was always a bit sceptical of, but I've actually started really enjoying. Being active, being physically active. So I've been helped by getting a new dog, well, my first ever dog, in the autumn, and going out for walks with my little boy, and spotting those early signs of spring, and just a couple of walks a day has really helped. Giving a bit of time to others, giving a smile on the street, just random acts of kindness can do a lot to boost our well-being. And then taking notice of the small things that make us grateful. So I remember listening to a radio interview with a lady who had experienced quite significant suicidal thoughts and suicide attempts, and the intervention she said helped her most was to write a gratitude diary. So each day just finding one thing to be grateful for to help lift her mood. And it sounds so simple and such a small act really, but she said it was absolutely life-changing for her in terms of shifting her perception. So think about what you can do. Look after yourself, look after others. I know as things open up, I will certainly be feeling a bit anxious about meeting in larger groups. So I would just encourage people to really be kind to each other, be kind to yourselves. Ease yourself in gently, and recognise that when we're out and about, other people may be feeling a little unsettled. So just to be really considerate to others in terms of how they're feeling. But of course, making the efforts to connect with people is really important to support us all. So, you know, we are social creatures, and we've been deprived of a lot of that over the last year. It's been quite easy at times to kind of think about what's gone wrong over the last year, criticise some measures that have been taken, or, you know, just focus on the negative or the dread of what may come. But actually, I've realised recently that I need that shift in my own mental outlook, really, to start thinking about the hope. This will come to an end, and we're almost there. We've got the amazing tool of the vaccines to help get us out of this. I was reading a little bit about the 1918 pandemic the other day, and actually it was only in 2005 that we mapped the genome for the influenza virus that caused that pandemic. So it shows how amazingly technology has advanced. And just fantastic that we've got these vaccines that have come out. Now, I know there's some concerns about potential risks and side effects of the vaccines, but if you look at the risk-benefit kind of a calculation, that weighing up of risk versus benefits, it's absolutely still more beneficial to go for the vaccination. The data in terms of the blood clots, I was looking in Europe, I think it was 96 cases of the blood clots based on 34 or 36 million doses being given out. I forget the number, but I calculated the percentage, and that's a 0.0005 percentage of people that have experienced these blood clots. So it's a very small risk, and we do think now that it's kind of more contained in particular population groups, so younger women. So as the vaccines are rolled out to younger age groups, people will be offered a choice in vaccine. So if you are concerned about a particular one, you can hopefully have a choice that suits you better. So just wanted to share that with you. Really, it's been a difficult journey, but there is definitely hope ahead. I'm we're really pushing to kind of get some of those positive benefits in terms of societal changes that the pandemic may bring. So environmental benefits, a real focus from the NHS and public sector partners on addressing health inequalities, and actually engagement with a lot of businesses that want to support those efforts as well. So there will be good things that come out of it, and we will be able to connect and see friends in a normal way soon. So please take care and look after each other. Thank you.